We've been reporting this week on the U.S. Surgeon General declaring gun violence a public health crisis. Firearm deaths among children have gone up nearly 90% in the last decade, and the American Academy of Pediatrics urges doctors to discuss firearm safety with their patients, because for many it's remained a taboo topic. Well, in tonight's Eye on America, CBS's Nikki Battiste reports on doctors working to change the conversation around safe gun storage.
This gun range may feel a world away from a doctor's office, but these are medical professionals training to save lives by learning about guns.
I felt like I had a real deficit in talking about firearms with patients.
We sat in on the class Dr. James Bigham teaches at Max Creek Gun Range in Wisconsin.
First thing I want to start off with is the bullet.
With shop and gun owner Steve DeRazio.
That's part of being the responsible gun owner, is knowing right from wrong.
A primary care doctor and professor at the University of Wisconsin School of Medicine, Dr. Bigham asks his patients about how they store their weapons in routine visits.
People may feel it's too personal, but as a physician, I absolutely think I have the space to say we got to be doing everything we can to protect our children, our communities.
In 2018, the NRA tweeted regarding this topic that doctors should stay in their lane. What's your response to that?
Yeah, I think this is our lane. As a primary care doctor, if I'm willing to counsel you on alcohol consumption, tobacco use, how you're driving your car, I got to be talking about firearms as well.
Is this a Second Amendment issue?
I don't think so. I mean, we have the right to bear arms. I sell guns. That's the last thing I want to do is take away my guns. It's not about taking away. It's about safety, and that's it.
Nearly 500 people a year die from accidental shootings. Gun suicides are at an all-time high for adults, and suicide rates for children have risen dramatically. Access to unlocked firearms in homes makes suicide nearly 4 times more likely. There are about 30 million children across the country living in homes with guns.
Studies show a child as young as 3 has the strength to pull this trigger.
Pediatricians at the Children's Hospital of Philadelphia say asking parents about safe gun storage is as important as asking about bike helmets and pool safety.
Are there any guns at home?
Dad is in the Army, so there is one, but we actually got a lock here for it.
To share your experiences.
Dr. Dorothy Novick is also teaching these soon-to-be doctors how to broach the triggering topic.
All of the injury prevention, safety counseling that we offer, we now wrap firearms right into that conversation to really make it normal.
The hospital provides these gun locks to families, one step in making homes safer.
This is really a conversation about safety. This is not a question about politics or ideology. And in fact, people from all across the ideological spectrum all agree that firearm safety is really a fundamental tenet of responsible firearm ownership.
Critical care, starting with a life-saving conversation. For Eye on America, Nikki Battiste, Philadelphia.